After the 1 o'clock news, about 1:30. See you then.
Thank you very much, Ollie. See you later. Interim evidence from the largest ever UK lung cancer screening study has found thousands of lives could be saved if people at risk of developing Britain's deadliest cancer were screened to diagnose it before it becomes incurable. UCLH's Summit study began in 2019 to detect lung cancer early amongst at-risk Londoners and to support the development of a new blood test for the early detection of multiple cancer types. Well, we can talk now to Professor Sam James, a respiratory consultant at UCLH, the senior investigator on the trial. Welcome. Thank you. This sounds obviously like a really exciting development. I know that your scans picked up 70% of growths in people's lungs at stage 1 or stage 2. So can you tell us how that compares with previous detection rates?
Yes, the Summit trial has really been pretty extraordinary, the impact it's had on our local lung cancer in London. So usually when, for example, I do my clinic, probably 7 or 8 people that come to clinic present with lung cancer when it's incurable. So the first time that they seek advice from doctor, the disease has already spread around the body. And this makes it very difficult to treat. Now, with CT screening, what we're finding is that in these clinics, 7 or 8 people are actually coming to the clinic with a cancer that's been detected early. So we're able to offer these people a curative treatment, and it's having a huge, huge impact.
So you basically go from a situation with 7 out of 10 people you're seeing being incurable to 7 out of 10 being curable.
Yeah, that's exactly right. And I think one of the other really important things we're learning from this study is that people are actually really engaged with the process. So we send them invitations called a lung MOT or a lung health check invitation. And actually, we're getting a great response rate. So more than half the people in a pilot study actually replied to these invitations from their GPs. And this includes people often thought as being quite hard to reach. So people from sort of socioeconomically deprived locations in London. So we're really excited by these findings.
So for something to be able to have such a transformative effect, you obviously just want it to be rolled out immediately, but this is just a study. How easy is it to scale this up and roll it out?
So I think this is one of the sort of key targets of our study. So we know from 2 previous studies, one in the United States and one based in Europe, that CT screening works, so it saves lives. But one of the real hindrances to CT screening is that the UK, Europe, really countries all around the globe are really struggling with trying to understand the feasibility of CT screening. So within Summit, what we wanted to do was really for about 2/5 of London, take this on. And so we've built 4 CT screening centres and rolled out a programme, which I think could be mimicked by the UK and elsewhere.
So when potentially could it be rolled out? When you say they're struggling to understand the feasibility, is it because of the cost of it? What are the issues?
Yeah, I think costs are vital, and the UK government and the National Screening Committee will want to understand what those costs are before they implemented CT screening. Initial results from another small UK trial showed actually the cost efficacy looks remarkably good. The other thing is workforce. So do we have enough CT scanners? Do we have enough radiologists to read the scans? But I think actually what Summit has shown is that with relatively slick reporting, we use computer-assisted detection software to enable quick reporting, that actually all of these things are achievable.
And your study was calling in people who are at risk. Who is at risk here?
Yeah, so our study looked at people between the ages of 55 and 78. And what we did is we used GP databases to look for people that are current smokers or ex-smokers. And those people are invited by their GPs and they call a number. And basically on that telephone call, we assess their overall risk for lung cancer. So that includes their age, how much they've smoked either presently or in the past, and another few sort of smaller factors, family history, asbestos exposure, things like this, which have less influence. We then get a sort of full assessment of their risk. And then if they achieve that risk, they're invited up for their lung health check and potentially their CT scan.
And what's been the reaction of patients that have been detected through this study? I mean, I would imagine massive relief because they're aware that it's something that they wouldn't have known about until a much later stage otherwise.
Yeah, that's right. So the people that we've detected a cancer in, clearly they're pretty shocked to start with. But as I've said, the majority of those people, so it looks like 7 or 8 out of 10 of those people are going on to have surgery, which we hope will be a curative procedure for them. And when they spend their sort of 3 to 5 days in hospital, having had their surgery, then I see them 6 weeks later in clinic. And actually, yeah, they're so relieved to have had this detected early, because lung cancer, it's a bit of a silent killer. It tends to just grow and spread before a person knows that they've got it. So these people have really sort of had what we hope is a life-saving intervention for them. And we hope now that we can roll this out more widely across the UK.
Professor Sam Janes, respiratory consultant, thank you.
Thank you.